Hi, I'm Diane Allen, and welcome to This Is Me, talk show for the 50-plus woman. On today's show, I'm here with Doctor Anne Tenthoff, MD, from the Jefferson Healthcare Network, and Dr. Tenthoff has been my healthcare provider for many years, and she's taken very good care of me. And I want to welcome you, Dr. Tenthoff, to the show. And again, I want to thank you for taking time out of your busy schedule for this interview.
Thank you so much. It is a pleasure to be here.
Thank you. And again, it's been my pleasure having you as my healthcare provider. And I want to say you are a wonderful, fantastic doctor. Anybody looking for a family physician, please. She is one of the best here.
Oh, thank you. Thank you so much. That means so much for me to hear.
And you have been such a good healthcare provider, wonderful provider for me, so thank you, as well as for my husband as well. So
it has been a pleasure getting to know both of you over all of these years.
So October is Health Awareness Month for women, as well as breast cancer awareness. So today's show, I do want to talk about the importance of we as women taking steps towards making sure we take care of ourselves. And maybe you can just maybe talk a little bit about what maybe 3 or 4 steps on what we can do and changes that we can make to make sure that we stay healthy.
Okay. So as women, as we know, when we're getting into our 40s and 50s, our bodies go through a lot of changes having to do with hormonal changes. And it does wreak havoc on our metabolic system and on some of our risk factors for cardiovascular disease and other illnesses. So the number one most important thing that we as women in our 50s can do is exercise and focus on a healthy diet. That is without a question the most important thing. And exercise is modest. Really, 30 minutes a few times a week is sufficient to keep our bones healthy, to keep our heart healthy, and to stave off a lot of the medical problems that happen after we've hit menopause and our estrogen levels drop.
We do want to talk today maybe about some of the top diseases that are affecting women. And I know right off the bat, maybe we may not even be aware of it, maybe some of us are, but the number one killer for women is heart disease. And it's not really talked about because I think it's mostly seen as a men's disease, but it is killing women. 1 out of 4 deaths are related to women's, as far as heart attacks.
Absolutely. Heart disease and cancer and COPD are still the 3 main causes of death in the United States. And a lot of these are preventable with taking good care of ourselves. So heart disease is important. And when you think about women, the risk factor becomes a little bit more as we get older, where men, it's a disease of being slightly younger. So I think that's why a lot of people don't think of it as a disease of women.
Yes.
So as we get later into our 50s and into our 60s is when that risk factor really becomes equivalent to the risk factors for men. And when you think about risks, it's having high blood pressure, high cholesterol, diabetes, being overweight or obese, smoking, and then a family history. So we can't do much about the family history, but the rest of them we can really work on and make sure that we're modifying those risk factors to decrease our risks of having heart attacks and strokes.
And just like you were saying, make sure we exercise and having a healthy diet. You know, those 2 things can definitely lower our risk factors.
Absolutely.
And I know hereditary may play a part in that as well.
It does. So a family history of heart disease does put you at an increased risk for heart disease. Unfortunately, there's not much we can do about that. We tend to be a little bit more aggressive as physicians in testing patients who have that family history for their cholesterol, their diabetes, and their high blood pressure. So when you come to see me in the office, those are the things that I'm looking at right off the bat and working to control as much as possible to decrease that risk.
I know women of color have a higher death rate as far as heart disease and heart attack.
They do, and a lot of that actually has to do with access to health care and having a working relationship with a physician who can help to modify those risk factors.
And I know for African American men as well is higher. So ethnicity has a role in that as well, or is it just mainly the, like you said, not having the health care?
It's a combination of access and genetics. So there certainly is a predisposition for certain people that they are more likely to have heart attacks and strokes. The other problem often becomes for people of color is access to adequate health care. And so if you are not able to get to that doctor and control your diabetes and control your blood pressure, your risk factor is that, or your risk for a heart attack or a stroke are that much higher.
So the next one I want to talk about is, because this is October and it is Breast Cancer Awareness Month as well. So we want to talk a little bit about breast cancer. We know that the guidelines have changed for screening and also maybe what we can do far as prevention as well.
Okay, so 1 in 8 women in the United States actually get breast cancer. So it is very, very common. It tends to be more common after the age of 50, and the guidelines are almost always in flux. So once again, having a family history of breast cancer increases your risk significantly for having a breast cancer of your own. The most important thing that we can do is get screened. And the best testing still for screening for breast cancer is mammograms. One of the things that is very important about mammograms is that we compare the imaging test over time. So we're looking at your mammogram from 2017 to 18 to 19 to 20 and making sure that there's no changes over that period of time. So it's really important to get your mammograms done consistently.
Right.
There is a little bit of question of whether you need to do it every year or every 2 years, and your own personal risks, history of abnormal mammograms, and your family history come into play with that. But at the very least, every 2 years, more often usually between your 50s and 60s, we really do like it to be every year.
And now, is it true that younger women, we're seeing more cancer in younger women? Is that true? And maybe why is that?
Yes, we are catching a lot more cancers in younger women. Part of that is that our testing is just that much better. So where 10, 15 years ago, our mammograms weren't nearly as sensitive, so we weren't catching a lot of those very early cancers, where now we're catching them and actually able to make significant improvements in patients' health as a result of that. Part of it is that there was a huge push to get more people screened. So I think it's a combination of that and not really a higher prevalence of disease.
Okay. Now, self-examination, how important is that?
So that's one of the places where the recommendations have really changed, and they're no longer recommending self-exams the way that they once did, because most of us aren't able to catch a mass at that point. Obviously, when you're showering, and it's especially useful when your hands are soapy, so when you're showering, check your breasts periodically and make sure that you don't feel anything abnormal. One of the other recommendations I make a lot is to have your partner check your breast. They are actually more often much more familiar with your breast than you are with your own. And so that's a really good way of making sure that if your partner or you feel anything abnormal, you certainly want to make sure that your physician is aware of that right away.
That's true.
We do still do a regular yearly breast exam as part of our physical exams as well as physicians for patients.
And the cure rate, has that increased or?
So the overall cure rate is much better than it used to be, and part of that is again because we are catching cancer so early. So a stage 4 breast cancer still has a very, very low survival rate. But a stage 0 or a stage 1 breast cancer has very high survival rates. So if you catch a breast cancer before it has spread anywhere else, there is, for stage 0, about a 96% 5-year survival rate, and for stage 1 it's in the 80s. So those are very, very high success rates in curing cancer.
Wonderful. I wanted to talk, maybe touch on a little bit about the reproductive cancer, like ovarian and uterine or cervical. I mean, if you could just maybe touch a little bit on those too.
So I want to say one more thing about breast cancer, though. The most important thing, and the reason that we have had as much success as we have had, is that if we catch a cancer early enough, that's when we can really make a significant difference. And the only way to catch those cancers early is to do screening. If I already have a lump in my breast, the likelihood is that cancer has already spread. And so that's why mammograms are so important. And that's why not just mammograms, but screening for the other cancers that we screen for as well is so important. Colon cancer, cervical cancer, and breast cancer are the three main ones that we screen for in women. So for other reproductive cancers, the three main ones are cervical cancer, uterine cancer, and ovarian cancer. And each are actually very different in their how frequent they are and what their survival rates are. Luckily, with the introduction of the pap smear, we have been able to decrease cervical cancer deaths significantly in the United States.
That's great.
It's one of the rare cancers that is actually caused by a sexually transmitted disease, and it which causes a lot of negative connotation, and it's really not that about being promiscuous. It's about a virus that is very, very common in our society that can lead to cancer if untreated. So getting pap smears is important in order to prevent that cancer or those abnormalities growing into a cancer. The good news about cervical cancer is it's very slow growing. So that's why we can monitor over time to see if there are changes that would be concerning for cancer. The good news is, in this case, the recommendations for treatment have changed kind of in our favor as women. We used to have to get pap smears every year. Now it's every 3 to 5 years, depending on what they find when they do the test. And that's because we do some other testing specifically for HPV as part of that. It is important up to the age of 65, at least, to make sure that you are getting your pap smears done regularly. A lot of women stop after they're done having babies, and it is important. Cancer is a disease of older people, so it is important to make sure that you're getting those pap smears done regularly. And again, that recommendation is every 3 to 5 years. Ovarian is much more difficult. There's no great screening tests for it, and because it is a cancer in your abdominal cavity, it has often grown very, very large before a person has any symptoms of it. So that one is very difficult to screen for, and unfortunately, because of that, has much higher mortality rates than something that we can screen for. Luckily, it is less common than breast cancer, but it is much more lethal. The most important things that we can do for that is see your gynecologist on a regular basis who does internal exams specifically looking for changes to your uterus or to your ovaries. But also, if you notice any changes to your bowel habits, to your abdominal girth, which we'd all love for there to be an underlying reason why we're getting larger, but if you notice that you're feeling firmness in your lower abdomen, or that your weight is changing without a lot of reasons why, those are things to make sure that you talk to your doctor about to make sure that there isn't something else going on in your ovaries.
So seeing these doctors, gynecologists, and family physician, should be something that we should be doing on an ongoing basis.
And really yearly, exactly. Annually is the most important thing, so that we can go over all of your risk factors, any symptoms that you've been having, and figure out if there is something concerning for cancer about that. The third of those three cancers is endometrial cancer, and really the hallmark of endometrial cancer is postmenopausal bleeding. So if you have gone through menopause and not had your period for a year, and then develop bleeding again, you need to let your doctor know right away. Okay, because that is, in my opinion, cancer until proven otherwise. Okay.
I want to talk a little bit about diabetes, because I know that is another disease that's women face as well.
My stomach just growled when you talked about diabetes, because it always reminds me of food. So diabetes, unfortunately, is very, very common, and is only becoming more common. We as a society are getting more and more obese over time, and that is one of the main risk factors for diabetes. Women of color tend to have higher rates of diabetes as well compared to Caucasian women, so that is a concern as well. And I don't know the exact estimates, but the number of people currently walking around without even knowing that they have diabetes is astronomical. There are millions of people who haven't been tested, so don't even realize that they have diabetes. Most of us don't have symptoms. That's the other really difficult part. So type 2 diabetes, which has to do with insulin resistance, the insulin that you have in your body is no longer working as well as it should, is a very gradual onset. So most of us don't even realize that we have it.
Right.
Some of the symptoms that you can have are increase in thirst, increase in urination, blurry vision, a very, very dry mouth. Those can be signs, but the vast majority of people that I diagnose with diabetes have no idea that they had it.
Sort of like high blood pressure is, some people walking around with high blood pressure don't know they have it either.
Absolutely.
Another silent killer.
So the most important way that we test for diabetes is through blood work. It's a simple blood test. We check both your fasting sugar, and then if that's abnormal, we check your hemoglobin A1C, which gives us an average of what your sugar has done over the previous 3 months, and that will give us a diagnosis.
Maybe I just want to touch on mental health and depression, because I know that's something that women struggle with as well. What can we do to, and what maybe are some of the signs to say that, this is just more than a down day?
So you asked specifically, how do you know it's not just a down day? So the real issue is, are you feeling that way more than just here and there? Are you feeling hopeless, sad, not enjoying activities the way that you once did, sleeping more or not sleeping at all? And if it's happening every once in a while, it's probably a down day. If you notice that that's happening more days than not, that's something to be concerned about. A lot of times depression and anxiety come out as anger. So if you're finding that you're having a short fuse, that can be another sign that your stressors are getting to you.
Oh, I want to thank you, Dr. Tenthoff, as you have given us such wonderful information, and I've just enjoyed. We could be here all day, but I know you have patients to see, so I want to thank you for taking time out your busy day to sit down and talk with me and with my viewers about women's health and women. As you, Dr. Tenthoff, was saying, one of the things that we can do is exercise and have a healthy diet, see our healthcare providers, talk with them, make sure we're going to the doctor, seeing our doctors' annual checkups and getting those things done that we know that we can do to stay healthy. So again, Dr. Tenthoff, thank you for joining me today, and thank my viewers. And our contact information is down at the bottom of our screen. We are on Spotify and some of the other podcast networks. So until next time, I'm Diane Allen, and this is me.